It's more common than you think. And now, thanks to the incredible doctors and scientists at RIA Endovascular, it's more treatable than ever. Dr. Pete Stratil stopped by to share with us the huge advances in technology and how he can now non-invasively heal various vein diseases. Dr. Pete Stratil is here today with us. What exactly is an interventional radiologist? Let's start right there.
Yeah, an interventional radiologist is a physician who performs minimally invasive surgeries. Many of these surgeries used to require open procedures, but now we can all do them basically through a needle stick.
Okay, well that is great to hear. It makes it a whole lot easier in terms of recovery, the time spent going through a process like this.
That's correct.
What types of specific procedures does an interventional radiologist perform?
So actually a wide variety of procedures. We do everything from arterial and venous obstructions to treating certain types of cancer to treating actually spinal fractures in the back. So kind of a wide variety of things.
Yeah, it sounds like if a patient's coming in for this type of work, this is going to be a quality of life game changer, right? Really dealing with some issues. So today we're going to specifically talk about a part of interventional radiology, venous disease. Let's talk about the specifics and some of the symptoms.
Sure. Most patients and many patients consider venous disease to be really a cosmetic concern. In reality, venous disease can cause really lifestyle limiting pain and swelling in your legs. Venous disease varies from varicose veins to blood clots that you have, actually to obstructions elsewhere in the body that can block the blood flow.
And for somebody who's going to go through this process and get these symptoms treated, what's the difference of quality of life before versus after you really deal with what's going on?
Right. We have many patients who we see who actually present with the inability to really stand for long periods of time. They can't exercise very well, can't interact with their family because they need to lie down and put their legs up in the air. And this can actually vary all the way to really more serious venous disease. And this is where a lot of people don't understand that this can happen, where you can actually develop wounds that open up on your legs. One of the things I wanted to highlight for people is if you or a loved one have dark skin discoloration around your ankle or have had what you thought was cellulitis or a skin infection, that's actually most likely due to venous disease. That's kind of the end stage of venous disease.
Okay, so these are some of the red flags or symptoms that folks who are watching at home may want to make that first phone call to you and your team to find out what can really get this process started. So what are some of the other issues that we may be visibly recognizing that we may want to call about?
Right. So varicose veins, as you know, that's one of the things that people can outwardly see. The other types of symptoms that you can have are really, if you have leg pain, leg swelling, inability to really stand. These are the types of symptoms that you'd really want to call us about. There are two other quick vein problems that I wanted to highlight. These are problems that a lot of people don't know about, and they're actually underdiagnosed. The first is something called May-Thurner syndrome, and the graphic you're looking at represents this. If someone has left leg specific pain and swelling or has had a blood clot in the past in their left leg, that may be due to compression of the big vein up in the pelvis, which is the main vein that is draining the left leg. Basically, the artery squishes the vein. That forms kind of an hourglass at that area. So all the blood trying to come up from the left leg hits a roadblock, and that increases the pressure in those veins. That can cause leg pain and swelling and even blood clots. We can actually treat that with a very simple procedure where we place a stent within that vein to hold it open against the compressive forces by the overlying artery. The second quick condition I wanted to mention is if someone has had a blood clot in the past in either leg, this can actually form scar tissue within the veins. If you picture kind of cutting your arm, that scab that you have, that can happen and form on the inside of the veins, which can scar the vein down. And that can also block the blood flow coming up. And we can actually open that up with a very quick procedure. In the past, many physicians have told their patients that there's really nothing we can do about this, just wear compression stockings. Now we can actually open that up, so that's a pretty exciting advancement.
Yeah, it sounds like your options are going to interest a lot of our viewers at home. Might be going, what is this left leg pain that I'm feeling? I should just call and get it checked out.
That's right.
Can some of the symptoms, if they're left untreated, cause even bigger problems than maybe just the physical outward appearance that we're noticing and maybe annoyed by?
Yes, they can. As I was mentioning, if you do have that dark skin discoloration, that's kind of as you're getting pretty far along in vein disease.
Right.
That can lead to even open wounds and skin ulcers. It's just really, really serious.
So let's talk specifically about varicose veins. If somebody is worried about maybe what's changing in their body and they want to make this first phone call to you, what can you and your team specifically do to really help improve the overall situation?
Well, varicose veins, first of all, are basically when blood is flowing the wrong direction within the superficial veins of your legs. Everyone has two systems of veins. The deep system is the most important system. That brings 90% of the blood back to the heart. The superficial veins are the ones that are associated with varicose veins. And if the blood starts flowing the wrong direction, because the valves within those veins that are supposed to open up to allow the blood to flow up towards your heart, but close down to not allow the blood to flow back down towards your feet with gravity, if those valves stop working, basically the vein becomes a hollow cylinder and blood can flow the wrong direction. That increases the pressure in the veins, pushes out on the walls of the veins and causes them to dilate, and that's what a varicose vein is. And it can also cause leg swelling because fluid can leak out.
Gosh, just the name varicose veins, I've heard that so many times. I had no idea that the blood flow was going the wrong direction, and that's what you are working to fix. So
that's correct.
How do you evaluate and treat the varicose veins, determining the severity, etc.?
The first step in evaluating for a varicose vein is to actually look to see if those valves aren't working well. We do that with a fairly straightforward ultrasound that's performed in our office, where we can actually see if the blood is flowing the wrong direction. If the blood's flowing the wrong direction, that tells us that those veins are not productively bringing the blood back to the heart. The blood's actually flowing towards your ankle.
Right.
So we actually want to shut down those veins. We do that with a few simple procedures that can be performed in our office. And again, the goal is to shut down or remove the veins that aren't working well.
All right, but it all starts with that simple evaluation,
That's
and then
correct.
you make those decisions from there. Now, I know that there are a lot of places out there where we can go and start this process, but really, what makes the RIA Vein Center stand out from the rest?
RIA has 12 interventional radiologists, and we don't only focus on varicose veins. We actually focus on the whole body venous and arterial systems. And so we can look at some of the other diseases that could be impacting your veins, recognize those, and treat those as well.
All right, and how can folks get in touch with you?
They can call our clinic. The number is 720-493-3406, or can reach us online.
All right, thank you so much, Dr. Stratil.
Thank you.
All right. Use the doctors who are trusted, renowned, and minimally invasive. Take the questionnaire. If you feel like you're suffering from any of the symptoms, give RIA Endovascular a call at 720-493-3406 to see your options and how the